Now, coming to the other aspect of management, which is the medical management or the curative healthcare. Medical science has improved tremendously in the last 10 years. What used to be a metformin or a glimepiride is now also supplemented with a variety of other drugs, often which also helps in protecting kidney and protecting heart. But this needs to be done with the help of an endocrinologist. It is extremely important these blood sugar levels and associated complications and parameters are checked, and then an endocrinologist decides what kind of medications to be done. The HbA1c, the 3-month blood sugar level, is something that needs to be checked at least around 6 months if you're already diabetic, and if it requires any medications or management or change in it, has to be administered with the help of an endocrinologist. Remember, self-medication is very bad, so equally important is that you do not down-regulate or up-regulate the dosages by yourself, because there are various class of drugs to manage diabetes. The way one type of a drug would manage, say, way a glucagon or a glycophage or a metformin would bring down your glucose level is very different from, say, a Janumet or a dapagliflozin would do. So for a doctor to decide which tablet and why, there is very significant specific reason. So do not self-medicate. That's very, very important. Lastly, these are all lifestyle change, right? Now, we go by the principle that what gets measured gets managed, and what gets managed gets bettered. A diabetic person, if that person is checking his or her blood sugar levels every day, or at least every 2-3 days in the morning, and if that person sees the blood sugar levels are spiking, unknowingly that person will make some changes in their lifestyle. It might be in terms of, while probably having a tea or coffee in the office, probably will reduce the sugar intake a little bit. And these kind of smaller changes done cumulatively in a day would have contributed to do a significant change with regards to your glycemic management. Last but not the least, let me again remind you, this is a lifestyle disorder. For a lifestyle disorders, the primary management bit has to be lifestyle change. If you're doing this lifestyle change, you probably will bring back blood sugar levels to a reasonable extent. Medications are important. Do not shy away from medication thinking that, oh, they have side effects. The side effects of uncontrolled diabetes probably 10,000 times more than the medicines that you would be having.